Venefit targeted endovenous therapy delivered by the COVIDIEN closure-fast radiofrequency catheter is a minimally invasive treatment for chronic venous insufficiency, or CVI, that is easily performed in an office or hospital setting. CVI is a progressive medical condition where the valves that carry blood to the heart and the calf muscle no longer function effectively, causing blood to pool in the legs and the veins to swell. Under ultrasound guidance, the vein is accessed using standard endovascular technique by inserting a 7 French sheath into the vessel. The closure-fast catheter is inserted into the vein and advanced up to the saphenofemoral junction, or the SFJ, and positioned 2 centimeters from the SFJ. Again, under ultrasound guidance, paravenous tumescent anesthesia, or saline, is then delivered to the saphenous compartment surrounding the vein segment to be treated. This is done to enhance patient comfort, provide a heat sink to protect surrounding tissue, and to improve contact between the vein wall and the catheter during treatment. The catheter tip position is confirmed and adjusted as needed to ensure tip is 2 centimeters from SFJ. Once in place, infiltration of the junction can proceed. External compression is applied to assure good contact between the catheter and the vein wall. The Venefit procedure uses a segmental ablation technique, which heats a full 7 centimeter vein length in one 20-second interval. Physicians also have the option of treating shorter refluxing vein lengths with a closure-fast 3 centimeter catheter, which heats the vein in 3 centimeter segments. Working in concert with a closure RFG generator, the catheter is able to deliver controlled, consistent heat to each segment. After each segment is treated, unique shaft markings on the catheter aid proper repositioning to the next segment. The heat provided by the catheter shrinks and denatures the collagen and smooth muscle, resulting in the collapse of the target vein, creating a fibrotic seal and occluding the vessel. Blood flow is naturally redirected to healthy veins as the recovery process begins. The speed and precision of the Venefit procedure offers patients a rapid and mild recovery, while providing physicians with a controlled and repeatable treatment experience.